Hello everyone. Today we are going to discuss our new topic, that is normal labor. It is also known as Eutocia. In this topic we are going to discuss our various features, that is definition, characteristic, and the difference between true labor pain and false labor pain. In first we are going to deal with the definition. So normal labor or Eutocia, it is the series of events that take place in the female genital organs. What will be the female genital organs? That is uterus, cervix, vagina, pelvis, etc. to expel the viable products of conception. What do you mean by viable products of conception? It is said to be the viable products when a fetus can survive without the help of mother, and it is said to be 28th week of gestation in India, whereas 24 week of gestation in various United Kingdoms. From the womb through the vagina to the outside world. So now we are going to review the definition, that is, it is the series of events that takes place in the female genital organs to expel the viable products of conception from the womb through the vagina to the outside world. Now we are going to discuss the characteristic of normal labor. The first feature is the onset of normal labor should be spontaneous and at term. If it is preterm or if it is postterm, it is not to be said as normal labor, and if the onset of labor pain is not spontaneous, it is induced, it is not said to be as normal labor. So normal labor will be always normal labor when the onset is spontaneous and at term, with minimal aids, cephalic presentation and vertex. Whatever the presentation except the cephalic is not considered to be a part of normal labor. No prolonged labor or without any undue prolongation. What is prolonged labor? It can be discussed as more than 8 hours to deliver a fetus in multigravida patient and more than 14 hours to delivering a fetus in a primigravida. And the last feature is vaginal delivery. Any other mode of delivery is not to be considered as a part of normal labor when it is not vaginal delivery. Now we are going to discuss its difference between the true labor pain and false labor pain. True labor pain has various characteristics. The first one is increase in intensity, duration and frequency. Whenever the true labor pain exists, it will increase in intensity and duration and in frequency, whereas false labor pain will not be increased in intensity, duration and frequency. True labor pain always radiate to the back, whereas false labor pain will not radiate to back and considered with lower abdomen only. True labor pain cannot be relieved by enema or sedative, whereas false labor pain can be relieved by enema or sedative. True labor pain is always characterized by progressive dilatation of cervix and effacement, whereas false labor pain cannot be characterized by progressive dilation of cervix and effacement. True labor pain, it is regular and usually starts with 15-second duration. False labor pain, it is continuous of 30-second duration. The last one is true labor pain always characterized when show is present, and in the false labor pain always show is absent.